Hey, it's James here, and here's the amalgam video I meant to post a while ago. Not everything shown in this video is perfect, nor are these fills ideal. Think of the video as a live demonstration by a second year student, so take what you like and pass on what you don't like. Anyhow, hope you enjoy.
So the armamentarium for amalgam fills starts off obviously with your amalgam in the corner. We also have the dappen dish, which you'll be dispensing your amalgam into. Always use the butt of the mirror handle to engage the amalgam capsule and open it. You have your carrier and condenser. These will be your first two instruments that you'll use when filling and condensing your amalgam. After you've filled it adequately, you'll have your burnisher instruments, which you can use to get rid of gross excess and give a little bit of rough anatomy. There is also your actual carving instruments. These are similar to your waxing instruments, your discoid cleoid, your Tanner carver, which is a larger version of the discoid cleoid, and your half Holland back. Always have your standard mirror and explorer on hand, as well as cotton pliers to help set up your Tofflemire, as well as holding cotton. So before you begin, you want to make sure you analyze the original anatomy of the tooth. When looking at first molars, remember 5 cusps, and notice that the central groove has this kind of zigzag pattern. This dictates exactly how your grooves and your pits are going to be, and this influences your occlusion. In clinic, you'll do this with articulating paper, depending on each patient's bite. However, in simulation clinic, you're recreating typodont anatomy, which is perfect. Also understand the heights of the marginal ridges when we're looking at it from a buccal view, as well as a lingual view. Looking at it from many angles can help you realize that the heights are slightly different. You can notice how the curvature is on the outer portion and the inner portion of that marginal ridge. When recreating proximal contour, one of the most important things is building back a contact to use a sectional matrix. That's what we use for composites. However, for amalgams, we're going to be using a Tofflemire matrix. So, when looking at the Tofflemire band, you must understand that there is a place for the Tofflemire to sit in, as well as there are 2 knobs, one on the outer portion and one on the inner portion. The outer portion will tighten the Tofflemire within the retainer, and the smaller knob will expand or shrink the Tofflemire. When looking at the band, you'll also notice that it has a U shape. So with that U shape, you want to make sure that the U is facing towards the gingiva, so that the top portion is larger than the bottom portion. This facilitates it for sitting on the tooth. So when we put it together, make sure that you have adequate length engaging in the retainer, and make sure that there's no rubber dam being stuck in between the tooth and the Tofflemire matrix. Sometimes what you can do is you can kind of move it on the side, that way it can be placed in the posterior mandible or maxilla, and you can still have it facing out of the front of the patient's mouth. Understand there's also different sized bands, and make sure to wedge it afterwards once you have it in. It's very common to forget to wedge, and you will end up with an open contact, or you will end up with a lot of flash at the bottom. So when you triturate your amalgam, you got to make sure you triturate it for exactly 8 seconds. There is the possibility of doing either 7 or 9 seconds. That's the manufacturer recommendation. However, triturating it too little may not make a homogeneous mixture, and triturating it too long can make it set up quicker. So when condensing amalgam, it's easiest to use 1 spill at a time. 1 spill is 1 capsule. So use the back end of your mirror handle to dispense it into the dappen dish, and proceed to use your carrier and fill your carrier. Make sure to fill your preparation section by section and not just drown the whole entire thing in amalgam. It's really easy to do that, and make sure you condense in multiple directions, which involves using both lateral forces and horizontal forces with your amalgam. Make sure to always use the small end of the condenser first, and this is why it's important to have your isthmus width at a minimum of 1 millimeter. Make sure to push, and you should hear that kind of squeaky sound, kind of like a rocking chair. And make sure to seal the edges of your box by pushing. It's not going to seal on its own. especially as you realize it is a very sandy material once it starts setting up. Make sure to condense each individual portion before moving on to the next increment. It's important that you also do not start carving prior to condensing adequately, because it's very common for the amalgam to kind of flake off when it's still in its most liquid state and when it hasn't been pushed into all those nooks and crannies of your preparation. Always make sure when you fill your amalgams to overfill them slightly, because you want to make sure you have some bulk to work with when you're carving. You can also get rid of the excess either with a surgical suction, or you can push it off the preparation with the cotton. Just make sure you get rid of it some way or the other. At this stage, you can start out by carving and getting rid of the bulk excess, either using an acorn burnisher or T-ball burnisher. The idea here is not to use pressure and ditch your preparation, but simply to get rid of some of the bulk excess, going up those grooves, as well as going through what will be your central groove in the future. With carving, it's important to make sure on the occlusal surface, using either your discoid cleoid or your half Hollenbach, that you're always on tooth structure. Similar to waxing, you want to make sure your instrument is always in contact with tooth structure to avoid ditching. If you want to be careful, you can always keep it short of the central groove and redefine your central groove at the end. Always carve away from your marginal ridge to avoid messing with it once you've already defined it. Usually while the matrix band is on, you can get the rough height of the marginal ridge, but you won't necessarily need to get the final anatomy of it. You can use the discoid cleoid to get rid of a lot of the excess material that's up against the cavo surface of your preparation. And using a light amount of pressure is really important here. You can also use your accessory grooves as kind of a tool to get rid of flash that can be in sometimes hard to reach locations. When you're working on your pits, you want to make sure you don't have your instrument at too steep of an angle, making sure, again, you're half on tooth and half on your fill. Your anatomy does not need to be so defined as to include all these secondary accessory grooves, but we're more looking for having your buccal groove, lingual groove, and your central groove. At this point, you can make sure to loosen your Tofflemire retainer and remove it. First from the distal, remove the band, and in a straight oblique direction, you can remove the band without fracturing your marginal ridge. After removal of Tofflemire band, you can use an explorer around the edges, carefully removing any excess around the marginal ridge. You can also use your half Hollenbach to kind of clean up the occlusal gingival embrasures and use it in a direction going from the top to the bottom. This will get rid of any flash that came out from in between your matrix band and your fill. However, you should realize if you do have a ditch, no amount of carving will help you fix that. It's best advised, once you realize you have a ditch, to restart your procedure by removing the amalgam while it's setting. You can also use a wet cotton or a dry cotton to help refine your prep. One of the easiest ways to get more anatomy and help define your marginal ridge is making sure that you have a deeper mesial fossa. Don't exaggerate it too much, but a little bit of defining that can help make it so your amalgam doesn't just look flat. Your anatomy need not be sharp, but make sure it is clearly defined without making your amalgam too shiny. Working with it too long can release some of that mercury from it, and that's not good.